Did you know that one letter is missing in the name MRI? Yes, initially MRI was called nuclear magnetic resonance imaging. In this video we will discuss whether it is dangerous to undergo an MRI, whether an MRI can cause cancer, or if it can damage your implant. You are on Dr. Prokofiev's channel, where we not only talk about joint and spine problems, but also try to understand them. Some people are afraid to undergo an MRI due to strange myths. On the other hand, doctors say that MRI is a very effective diagnostic method. Let's figure everything out in order. But first, a small clarification. Why is an orthopedic surgeon telling you about MRI? The fact is that in my specialty, interventional orthopedics, the treatment of chronic pain, MRI has to be done so often for almost all patients, that one way or another, I have to understand this diagnostic method. However, I do not claim to be an expert in radiology or radiology diagnostics, and if in this video I say something inaccurate, please write about it in the comments. So, let's not waste time and start. Probably everyone watching this video has encountered the term magnetic resonance imaging. Some have already undergone this examination, while others are only planning to. But for those who have no idea what it is, I will explain. Magnetic resonance imaging is based on the principles of nuclear magnetic resonance. During the examination, the patient is placed in a strong magnetic field that affects the hydrogen atoms in the body. The hydrogen atoms in the tissues emit signals that are recorded and processed by a computer, creating high-quality images. These images show the damaged anatomical structures. The images appear on our monitors, and we use them to assess what is happening inside your knee joint, spine, or another part of your body. And here comes myth number 1. If we frequently undergo MRI, it can cause cancer. No, that's not true. Or rather, it's completely false. Because magnetic resonance imaging is not a radiation-based diagnostic method. During an MRI, there is no ionizing radiation, as in X-rays or computed tomography. Therefore, MRI is absolutely harmless in this regard. For example, in computed tomography, the radiation dose is very high, and CT cannot be done frequently. However, if you have 1, 2, or 3 MRIs in a month, your radiation dose is 0 because, as I said, MRI is not a radiation-based diagnostic method. It also has no correlation with other diagnostic methods. For example, if you have had an X-ray, ultrasound, or CT scan in the same month, and are afraid to undergo an MRI, there is no need to fear, as MRI is not correlated in terms of harm with these previous diagnostic methods. Again, if we are comparing magnetic resonance imaging, for example, with computed tomography, MRI has several advantages that allow us to more accurately diagnose soft tissue formations. The fact is that MRI very accurately visualizes soft tissue formations, while CT mainly visualizes bone tissue. Therefore, for example, in my field, we need to meticulously examine the soft tissues around the joints, menisci, ligaments, cartilage. CT is not the best diagnostic method for this. We can hardly see anything on it. In almost 100% of cases, we will choose magnetic resonance imaging. Magnetic resonance imaging is one of the most powerful and safe examinations in modern medicine. However, it is also not a panacea, and sometimes it is not worth starting the examination with this method. For some, this method can be deadly. Let's talk about this. Who should absolutely not undergo magnetic resonance imaging? The first and perhaps the main group of such patients are those who have various types of stimulators installed, a pacemaker or a neurostimulator. Mostly, of course, a pacemaker. Why can't you have an MRI with a pacemaker? Because, firstly, it can cause dislocation of the device. As you know, it is installed quite precisely, and a strong magnetic field can displace the electronics, can displace the device itself, which will lead to its malfunction. And most importantly, MRI directly disrupts the operation of the pacemaker. That is, it disables it due to the strong magnetic field. And a pacemaker is not installed just for fun. Most often it maintains the heart rhythm, ensuring your vital functions. Therefore, people with a pacemaker are most often strictly prohibited from undergoing MRI. However, there is an exception with an asterisk. There are now pacemakers that allow you to turn off the device during the MRI. So, if earlier we said that a pacemaker is an absolute contraindication, now we need to figure out what kind of device you have installed. The second category of patients is people with foreign metal objects in the body. I emphasize, not fixed metal objects. These are usually bullets, shrapnel, shell fragments, or some needles or other metal objects. Why can't you have an MRI in this case? For the same reason, a strong magnetic field can cause dislocation, that is, displacement of these objects, and their displacement can damage something in your body, a large vessel, a nerve, an internal organ. Therefore, people with metal fragments cannot undergo MRI. The next category of patients is pregnant women. Pregnant women in the first trimester of pregnancy. Despite the fact that MRI does not have ionizing radiation, we know how carefully doctors treat women in the first trimester of pregnancy. They are not allowed to do almost anything because there is not enough data on what can affect the development of the fetus in this fragile period. Therefore, in the first trimester of pregnancy, without strict indications, it is better not to do an MRI. The next category of patients is patients with psychological factors. For example, patients with claustrophobia may experience severe fear or discomfort during an MRI because they are placed in a confined space, and such patients are afraid of confined spaces. Well, there are some features here. First, many patients think they have claustrophobia, that is, they are afraid in advance. In fact, they do not have claustrophobia, and if everything is explained to them, if they are shown how it works, they can calmly undergo an MRI. There are studies that do not require a person to enter the tunnel, for example, an MRI of the ankle or knee joint. Even patients with claustrophobia usually calmly undergo this examination. Therefore, if you cannot undergo an MRI, perhaps you just do not know how it is performed, and you should consult your doctor to clarify this. And finally, if you really need to undergo an MRI and you have true claustrophobia, there are clinics where MRI is performed under anesthesia. That is, you are put to sleep and the examination is performed. So again, claustrophobia is not an absolute contraindication for MRI. And the next category of patients, let's call them special cases. The fact is that when you have recently had heart surgery, for example, a stent or clip was installed, the surgeons who perform the operation say that you cannot undergo an MRI for 3 or 6 months after the procedure. Usually after this period, an MRI can be performed. But if you have had such an operation, either the surgeon has already told you that you cannot undergo an MRI, or if you need to undergo an MRI, consult the surgeon who installed the stent or clip in your body. Usually, you should have a discharge note with recommendations on the possibility of undergoing magnetic resonance imaging. Myth number 2, perhaps the most common myth, is that the MRI machine during the examination can pull out your implants, break the endoprosthesis, or displace the plates installed during osteosynthesis if you have had a bone fracture. Let's talk about this in detail. But first, as the author of this channel and this video, I would like to tell you about my main activity. The fact is that I am not a radiologist. I am not a specialist in radiation diagnostics. I am engaged in orthopedics, I'm engaged in interventional orthopedics, and this is the treatment of chronic pain in the area of large joints and the spine under the control of high-precision equipment. With this approach, the risk of surgical intervention is reduced by 80%. Already after the first procedure, in about 70 to 80% of cases, a person's ability to work is restored. Also, with this approach, long-term hospitalization is not required. The procedures are usually performed on an outpatient basis in 1 day. I try to control all stages of the process, from primary diagnosis, evaluation of MRI results to rehabilitation programs after the procedure. You can learn more on my website and in my Telegram channel. To go to these resources, click on the More button under this video. Take the first step towards a life without pain. And we continue about magnetic resonance imaging. Let's talk about that group of patients who have metal structures installed. And it was previously believed that the presence of metal in the body is an absolute contraindication for MRI. Many doctors, many centers still think so. However, this is not the case. Just a little earlier in this video, I said that MRI can displace metal fragments that are in your body. But according to research, as I said earlier, freely located, non-fixed fragments. If your plate is fixed to the bone, the endoprosthesis is even more fixed to the bone, then MRI cannot displace these endoprostheses of the knee joint, or say a plate in the shoulder or lower leg. This is not a contraindication, for example, for MRI of the lumbar spine. True, such a study should be performed on a device no higher than 1.5 Tesla. Why am I telling you all this? Because understanding these indications and contraindications is very important for you. Often people come to me who have not been able to undergo an MRI for 5 to 10 years because they are either afraid or think that it is contraindicated for them, and their treatment is based on, for example, X-rays or ultrasound. But if, for example, you have a herniated disc or spinal stenosis, it is impossible to detect these changes on an X-ray or even more so on an ultrasound. If you do not have absolute contraindications for MRI, such as a pacemaker, neurostimulator, or those special cases that I mentioned earlier, then, of course, this diagnostic method is indicated for you. For you, it is safe and very effective. And finally, many patients live with the myth that they had an MRI once in their life, and now these results are always relevant. But, unfortunately, this is not the case. Yes, the MRI that you did some time ago is also important for us because it is important for us to compare the changes in dynamics. But in the body, fatal changes can occur. For example, in a minute thrombosis of the veins of the lower extremities is a very dangerous condition. Or they can change in a month. There was an ordinary hernia, and in a month it became sequestered. This fundamentally changes the treatment tactics. Changes can occur over 6 months, for example, a septic necrosis. We have talked a lot about this disease on our channel and also said that it is detected only by MRI. So, changes in a septic necrosis can go from the initial stages to the terminal stages in 6 months. And often we have to repeat MRI often every 3 months, every 6 months. This does not mean that we should constantly monitor the treatment results by MRI. Most often, it is not necessary to perform MRI very often, only with specific pathology. But if you once did an MRI a long time ago, it was 5 years ago, a lot of water has flowed under the bridge since then. The nature of the pain has changed, of course, you need to do new studies. And even better, it would be great to evaluate these studies in dynamics. We can evaluate in dynamics only when we have your first MRI, done several years ago, and when there is a fresh MRI. And finally, the next myth is what I started with. Is it true that MRI is actually called nuclear magnetic resonance imaging? Yes, it's true. Initially it was called that. Why was it called that? Because the principle of MRI is based on the change in the electromagnetic response of atomic nuclei in a strong constant magnetic field. However, after the Chernobyl nuclear power plant accident in 1986, the term was changed to magnetic resonance imaging. People after this accident developed radiophobia, and everything associated with the word nuclear caused them concern, and it still causes concern. But let me clarify once again, nuclear in the name of MRI is not related to nuclear energy, not to the Chernobyl accident, but to the principle of operation of the MRI machine itself. Therefore, there is no need to be afraid of this term. Perhaps that's all I wanted to say in this video about magnetic resonance imaging. I will definitely have a next video where I will tell you a checklist on how to choose the right MRI machine and how to properly undergo an MRI. So be sure to subscribe to the channel, watch my next video at this link. Goodbye everyone.